target rank is 15 to 25,000, then core BTR has a strike rate of 130 to 160 questions. You can do the core BTR. In case your target is 2K to 15K rank or your concepts are not clear, then you will have to do rapid revision from Marrow or PrepLadder or Cerebellum or DBMCI. So you do pre and paraclinical 8 subjects, with that medicine, surgery, OBGY, pediatrics. After the INICET, take 1 or 2 days rest, then you will have to come back because you have very limited amount of time for NEET PG. Do all the rest 7 subjects. From 1st June to 19th June, you do one solid revision and you do PYQ annotations in your primary source. How to crack NEET PG starting from scratch, because only 140 days are left for NEET PG. Now this question will haunt you if you are starting now, whether it is possible to crack NEET PG 2026 or not. Let me assure you, it is fairly possible. 140 days are left and realistic expectation you can do is 15 to 25,000 rank, and with that rank you can get DNB OBGY, DNB orthopedics, or in some states you can get MS orthopedics and MDMS OBGY also, and you can easily get psychiatry, PMR, eye, ENT, anesthesia, rad onco, and many more streams. So you will have a horizon open for clinical branches. Thus, don't waste your time. See the strategy I am explaining you, and if you like it, do subscribe to my channel because we are very soon to hit 40K subscribers. And if your basics are strong, good intelligence you are having good consistency throughout this 140 days, and you have a good exam day performance, then to आपके बल्ले बल्ले 2000 to 10,000 rank also you can get. I give you an example of my batchmate. He or she didn't got any rank in the INICET me. That means he or she was behind 50% of the students. In INICET November 2023, he or she got 1700 rank. So it is fairly possible in 140 days you can crack NEET PG easily. Now the question will come, how to crack NEET PG 2026 within this limited amount of time. In this case, I have assumed all the situations you may be facing and I am going to give you personalized guidance how to tackle it and how to utilize your time fully so that you can crack NEET PG 2026. First group of students, if you have watched only main videos and you are confident in your main videos, then what you should do, you should do the RR from the same platform. Don't change the platform. Scrap the unimportant topics which are not mentioned in RR and mark the previous year topics. So previous year topics of INICET, NEET PG and FMG you can get from the PYT list which I have prepared. The link is given in the description box below and pinned comment section. It has a strike rate of 140 to 180 questions in the main exam. Now if any topic is missing from your notes, main notes, then you will have to add the previous year topic in your main notes and you are going to bulk it up. This is the cut down strategy, that is you are scraping off the unimportant topics and you are adding important previous year topics. So you are bulking it up. How to add the previous year topic? If it is present in your RR video which is not mentioned in your main videos, then you can add it or you can search it from the chat GPT or from the PYQ solution. You will have to add it in your main notes. Coming to second group of students who don't have confidence on their main notes, which is the vast majority. In this time you will have to ask yourself a question, whether your concepts are clear or not. If your concepts are clear and your target is 15 to 25,000 rank, or you are having less time, means you can't study for that much amount of time, or you are having job. If you are having job, I will advise you to quit it because this 140 days is vital and you need to dedicate at least 7 to 8 hours of rigorous study to crack NEET PG, or else it is not possible. If your target rank is 15 to 25,000, then core BTR has a strike rate of 130 to 160 questions. You can do the core BTR. In case your target is 2K to 15K rank or your concepts are not clear, then you will have to do rapid revision from Marrow or PrepLadder or Cerebellum or DBMCI. These are the four authentic apps I know. And don't do multiple sources, choose one app and follow that only. Another situation is those who have done offline classes from maybe DAMS or Bhatia. Focus on your notes because offline notes is more or less like the RR content, maybe 20% more than the RR content, but it is revisable in this 140 days. And never follow TND or DVT as your sole source because these are only supplements. You can add on to your main notes or your revision notes or your BTR or your DAMS offline classes, but these are not sole sources. If you follow them, their strike rate is very poor. Only 25 to 35% is their strike rate. Then you are going to miserably fail. These are very much concise and not that much specific. Next thing is MCQ. MCQ you will have to practice because this is an MCQ based exam. This also has two situations. If you are having less time, you can't do that much of MCQs, then 5 years of NEET PG and three papers of FMG. That is the recent three papers, especially the FMG July 2026, because previous year 15 questions came direct repeats in NEET PG, and 50 to 60% of the topics were common in NEET PG from the last paper of FMG. So FMG is very much important, and since NBE sets question papers of both NEET PG and FMG, after NEET PG, FMG questions are the most important. If you are having sufficient amount of time, do 8 years of NEET PG, 5 papers of FMG and 8 years of INICET. PYQ is not just an assessment tool, it is itself a study material. The explanation that is given in either of the two apps, Marrow or PrepLadder, it is itself the previous year topic being explained, and each and every incorrect option is a future potential MCQ. So, the extra points you are getting in your Marrow or PrepLadder Q bank, you will have to annotate them in your notes, in your primary source. Like this pembrolizumab used in endometrial cancer. This was not given in my notes. I had added it and it came in INICET November 2022 twice. Like this, you will have to annotate the extra points. You will have to highlight the thing that has come in the previous year questions. Then only what will happen, the strike rate of note increases ultimately. The importance of the topic you understand because the immune checkpoints inhibitor, as you can see, is important for INICET but is not important for NEET PG. And your revision will be faster because you can only skim through the previous year topics in the last 10 days, and your PYT retention will be better. अगर मैं तुमको नींद से उठा दूं और एक को PYQ पूछ दूं तो तुमको करेक्ट आंसर देना पड़ेगा, ऐसा होल्ड बनाना पड़ेगा प्रीवियस ईयर क्वेश्चंस के ऊपर एंड प्रीवियस ईयर टॉपिक्स के ऊपर, देन ओनली यू आर गोइंग टू गेट अ गुड रैंक इन द नीट पीजी. In case you can't annotate, then you have an option to bookmark the MCQ and give the INICET May 2026 because it will be a real life GT. and अगर रैंक निकल जाता है, उन लोग 50 परसेंटाइल के ऊपर वालों के रैंक देते हैं, तो मतलब 40,000 में अगर रैंक हो जाए, then you will automatically gain confidence that yes, I can do much better in the NEET PG. Let's see the NEET PG and INICET marks weightage. From this, you can see that INICET has more questions on anatomy, physiology, and pediatrics. Rest all important subjects are the same only. So what you have to do, let's see the timeline. 16th of May, you have the INICET exam. So from this, we can see that the 12 subjects are important for the INICET, and nowadays anatomy is becoming more and more important in NEET PG also because 10 questions came in anatomy in NEET PG 2025. So you do pre and paraclinical 8 subjects, with that medicine, surgery, OBGY, pediatrics. After the INICET, take 1 or 2 days rest, then you will have to come back because you have very limited amount of time for NEET PG. Do all the rest 7 subjects. From 1st June to 19th June, you do one solid revision and you do PYQ annotations in your primary source. I have kept these days more because you are going to solve all the previous year questions and you are going to add the extra points in your main notes or your primary source. Then you do revision 2 from 19th July to 19th August and you make your 20th notebook because you have done two readings of your primary source. Now you know what is to be kept in the 20th notebook. I am going to come it in the future slides also. And in the last 10 days, you only see the previous year topics because you have annotated them in your source. You see the 20th notebook and you see digital image bank if you are having. And GTs, you will have to give one INICET mock test before the INICET, and GTs you start after the INICET when you have covered all 12 subjects. If you have covered 12 subjects, you are going to get 140 to 150 questions in common, and you will have an idea about the questions which are being asked in the grand tests. GTs, 10 GTs is enough. Always give a GT in a personal computer. Don't give it in a tab, because when I do the sessions with students, most of them they are doing it in the tab. The simulation is important. All the athletes, elite athletes, and you see the space astronauts, they do simulation of the main environment. They do simulation of how they are in space, in the earth itself, or they do simulation of running with the gunfire. So you will also have to do simulation sitting in front of the computer for 3.5 hours. Marrow mock test is good because it has maximum number of test takers, it has zero errors, but the main disadvantage is that the standard is more difficult. It has more number of 2 or 3 layered questions. Like that kind of questions are not asked in NEET PG. Prep ladder and doc tutorials are more like the NEET PG main exam, but there is less number of test takers. Your target percentile in the last should be more than equal to 75 percentile, and analyze your GT as soon as possible. First, you will have to see the wrongs you have done. If it is a recall error, visit your main source and see your error. If it is a conceptual error, go to your note, clear your concept, or if it is not cleared, then see ChatGPT. It also provides very good solution. Silly mistake, then you need to focus more during giving the exam. And if it is an unknown topic, if more than 40% have done it correct, then read the explanation. If less than 40% have done the question correct, then you can skip the question. Guessed corrects, then you will have to see. After that, you will have to see the corrects. You can skip the corrects also because you are having less amount of time. And no need to make a GT copy for you. Those who want to be in the top ranks, they can make a GT copy, but I am advising you not to make a GT copy. I personally didn't made any GT copy. And questions repeating from GTs in your main exam is highly unlikely. By solving multiple GTs, I have seen that at least 30 GTs I have solved, but I didn't get many questions common from the GTs. Main thing is you need to give two damn CBTs because it will give you the exam hall experience. Just giving in the PC won't give you the exam hall experience. You need to sit in the exam hall. For that, you give the INICET May 2026 and give two damn CBTs for NEET PG. 20th notebook is something that you will keep only volatile previous year topics. No need to keep other volatile points from your primary source like CA staging, while anything that you are forgetting and which is a previous year topics, you must keep it in the 20th notebook and you must read it every alternate day. Now, if you want this whole presentation, then do join my Telegram channel. The link is given in the description box below and the pinned comment section. After that, what you have to do, that you have to funnel down the bookmarks. Like first time, if you have 800 bookmark previous year questions, next time you review it, it reduces to 400, then it reduces again to 200. After you review again, you are going to memorize or you are going to remember some of the more previous year questions. You are going to understand the concept and you need not revisit them. then you remove the bookmarks and 50 are left. These 50 questions you need to review just before entering the exam hall. And if any question comes in the main exam from that topic, you are not going to forget it. Coming to digital image bank, what is a digital image bank? You can have it, or you can see the images from your notes also. It is completely up to you. I have made one digital image bank. It has 1850 plus images, and the main point is that I have annotated every previous year question of NEET PG, INICET and FMGE as PYQ. So you are going to understand that which images have come in the previous year questions. So you can get all the images in a single place and you can review it in the last days of preparation. The link is given in the description box below and pinned comment section. Coming to the most important thing, the mistakes you should avoid. Don't change your source. This is the biggest mistake I see while conducting personal sessions, that get into FOMO and they change their source. This is the biggest mistake you can do in this limited amount of time. I have given you the three situations and you will have to stick to that one source you are fitting in. Don't solve QBank, because I personally didn't solve QBank. I personally solved only 82 QBanks of Marrow during my internship and 270 QBanks of Prep Ladder during my final year. And it is simply waste of time. Let me assert you. I got AI at 29 just by solving previous year questions. So why you are going to solve QBank? Because they are being set by the PGTs. I also got offer from one of the top apps to set the QBank, but I am not having that much time, so I am not doing it. In QBank, you will see that many questions are there which are not there in the notes. So this is being set by the PGTs. They don't see the trends of the NEET PG and INICET. They see what is important for them and they set questions accordingly. Don't avoid FMG July recall, because I said you that so many questions came in common in NEET PG 2025 from the last paper of FMG. So I am going to conduct the recall session. If you don't want to miss it, do subscribe to my channel and click on the bell notification. And the most important thing, don't underestimate yourself. Join my Telegram and WhatsApp channel for NEET PG, INICET and FMG preparation. Daily 2 to 3 posts are made and MCQs are also being given. You are going to be in the habit of practicing and you are going to see many flashcards popping up, and when you use the social media you can utilize it in a better possible way. Now you can see video on most important topics of INICET and marks weightage of NEET PG. So go watch it now.